The Delta variant of COVID-19 continues to take the world by storm, present in over 100 countries and accounting for more than 98.9% of cases in the United States and 85% in South Korea. According to the US CDC, transmissibility seems to be double that of the original strain of COVID-19 and 40 to 60% of the Alpha variant, outpacing and even defying efforts to contain the virus and also vaccinate people against becoming severely ill. This has brought the idea of herd immunity into question and led public health authorities to start considering booster shots to keep immunity from waning. To ask how much hope herd immunity and booster shots provide us, we're joined by Dr. Mike Toole, epidemiologist at Bernard Institute, who leads the Centre for International Health there, and Dr. Chuan Oh, Professor of International Health Policy and Management at Seoul National University College of Medicine. Thank you both for joining us this morning. And well, Dr. Toole, we heard yesterday that from September, the US is going to start providing booster shots to people who have been fully vaccinated, but in order to make sure that their immunity endures in the months to come. How long does the protection from full inoculation actually last, and what kind of boost do these booster shots provide?
Good morning, Usium. We're only really starting to understand how long these vaccines work, because keep in mind we've only been vaccinating people since December last year, so we're up to 8 or 9 months. Now there's the most recent information on how long the vaccines provide immunity has come from the UK and from Israel. Now in the UK they have found that the Pfizer vaccine is around about 90% protective 1 month after your second dose. But then it goes down at 3 months to around 82%, and then at 6 months, just down to 78%. So that means the level of immunity is really not enough to prevent people from getting infected and, well, some people getting infected and passing it on to others. So Israel is the first country in the world to provide third shots, so booster shots. And they are doing that in everyone over the age of 50 who are vulnerable.
Well, Professor Oh, South Korea is aiming to reach 70% herd immunity by the end of October, but we are currently at 20% and it took us 6 months. Do you think this herd immunity goal is possible?
Yeah, I don't think it's possible, considering the past experience in the UK and Israel, which has a quite high-performing health system to deliver vaccine, and also no shortage of vaccine supply chain. So according to the experience, it is almost January for the Israel and also February for the UK, which when they arrived in the 20% of coverage, then now they got almost 70%, which is our target in the future. But it took more than half a year for those two ideal countries in terms of that no difficulties. So with supply chain management in Korea, it seems to be very difficult to get that very expedite achievement within 2 months, considering the past experience of two countries. Although I didn't consider the 70% is proper target or herd immunity is a really valuable concept, but let's ignore that. But 70% probably we cannot reach.
Mm-hmm. And well, Dr. Toole, now young people all over the world, they appear to have a relatively higher level of distrust or reluctance when it comes to getting vaccinated. Why do you think this is, and what do you think should be done to overcome this problem?
Well, I think maybe that distrust is more like complacency, because last year, in the first phase of the pandemic, young people tended not to be affected severely. So very few young people ended up in hospital, let alone dying. But this year, we're seeing a lot of young people getting infected, and that's just about every country in the world. We both mentioned Israel. Israel, despite a very high vaccination rate, is reporting more than 8,000 cases a day. And that's in a population of 9 million. And many of those people are young people. So I think the attitude of young people, and it's the same in Australia, the US, everywhere, we're seeing more young people being infected. Now that may be a combination of the fact that young people are less likely to be vaccinated, and that the Delta strain spreads so quickly within households, within families, that young people are being infected more than last year. Now, to get back to your question, that vaccine hesitancy may change as young people see that there are young people their age in hospital. Here in Australia, in Sydney, we even have teenagers in ICU. We had a 20-year-old die from COVID. So I think it's changing. Certainly in Australia, the age group that is taking up the vaccine the most right now is people between 16 and 30. So I think we might see a very important change in attitudes to the vaccine by young people.
Right, and of course a lot of young people have been affected by this very transmissible Delta variant, and there have been a lot of questions as to whether herd immunity is effective. And while Dr. O, an Oxford professor, Andrew Pollard, he said that herd immunity is a myth when it comes to the Delta variant. What are your thoughts on this? And with the Delta variant spreading so rapidly, do you think the target percentage needs to be adjusted?
Yes. Regarding the Delta variant, actually we didn't develop the vaccine based on Delta variant, so that functionally this is a new virus, so that it's not the fault of the vaccine in terms of vaccine imperfectness of the to the Delta variant. It's currently 49% of protection, so that it's just a half of the protection of the completeness. So considering that, if we consider all 100% are vaccinated, still it means 50% of herd immunity. So that adjusting, that's nothing in terms of herd immunity cutoff value. Although cutoff does not mean reality, we can incrementally get the benefit once better higher, the more or the higher number of immunity, the vaccination coverage, and we have better benefit. Although we can ignore that, but just when we focus on the 70% itself, theoretically 50% is maximum, 100% achieved.
Well, Dr. what are your thoughts on this, on herd immunity? I mean, with the Delta variant on the loose, will 70% herd immunity mean anything, or should the target percentage be adjusted?
Well, we've been following those countries that started vaccinating first in the world and have reached very high levels of vaccination coverage. And I agree, 70% is not going to be enough to allow us to ease restrictions, open our borders, and not have outbreaks. Now, we've talked about Israel, but let's go to the top of the table, Iceland. Iceland has the highest vaccination rate in the world. So it's well over 80%, and more than 90% of people over the age of 70 have been fully vaccinated. And yet Iceland is having the largest outbreak since the beginning of the pandemic. Now, they're mainly young people, and also not many people are being hospitalized. So that's a good thing that we have from the vaccine. It will prevent many hospitalizations and deaths, but it's not stopping the virus from spreading at even 80%. So I think Malta is another country, another island country, with a vaccination rate of about 80%, and they are also having cases. Now, the problem with just living with the virus is that now we know that many people who get infected end up with what's called long COVID. So this is many months after their initial infection, which may be quite mild. They end up having problems with their lungs. They have fatigue. They have headaches. They have a lot of impairments to their daily way of life. And so that will have a big economic impact. It will, for example, interfere with young people's studies at school and in university. It will affect the way people can work. So we can't just look at deaths. We have to look at the long-term effects of this virus. And as Professor Wu said, the Delta strain is spreading so fast, it's very hard to keep it at low levels. So I would be thinking that 80 to 90% will be needed for any kind of herd immunity. And as you said, some experts think that it's impossible.
Well, Professor, for now in Korea, it seems that the infection cases are expected to continue climbing. Many say that the current level 4 restrictions in place have failed, and while some experts predict up to case numbers rising to 3,000 a day. And well, from your research, it's very clear that non-pharmaceutical intervention measures need to be very strategic to keep these numbers down. What would you then recommend in order to really reinforce and strengthen this so-called K-quarantine that the government's been talking about? Could you elaborate on how this could be done?
Yes, please. The non-pharmaceutical intervention can be classified into two different groups. One is much more institutional, governmental orientation, which is focusing on the high risk of the infectivity groups, so that more specific action for those who are infected and also who contacted the infected people, because they are really highly probable to transmit their infection to others. While the other approach is a general non-specific approach to apply for everybody. So asking for everybody reduce their mobility and reduce their gathering to lower the chance of the undiagnosed infection transmitted to each other. So amongst these two, the latter is focusing on social distancing, so that mobility restriction is one of the main methods. But that is not really working well this year in the first outbreak and the third outbreak, while it was relatively effective in the first and the second outbreak in Korea last year. But continuously and then consistently, the institutional action, like quarantine and isolation of those high infectivity groups, that's still powerful to reduce the transmission. So we need to focus much more on the quarantine and isolation through the tracing and testing. However, increase the prevalence need more human resources to work appropriately, unless digital technology helps them to reduce the work time. So it is now time for refocusing on the K-quarantine, especially for quarantine and isolation method, by increasing the human resources rapidly.
Right, and Dr. Tu, now your institute's modelling has shown that even with high vaccine coverage, thousands of deaths could still occur if public health responses are not initiated to help control outbreaks. What are measures that need to remain in place regardless of the vaccination rates?
Yes, the Burnett Institute modelling, as well as modelling by another institute in Melbourne called the Doherty Institute, which is informing the Australian government's transition plan, have found that even at 80% fully vaccinated adults, so everyone over 80% of people over the age of 16, you still have to keep strong public health measures. And Dr. O has mentioned some of them, very important: social distancing, reducing mobility, a very strong test, trace and isolate or quarantine system. But I would add another measure which I think is increasingly important, and that's paying attention to airborne transmission, particularly indoors. So as you gradually open up, restaurants, bars, retail stores. We need to look at ventilation and improve it because it's been demonstrated in a poorly ventilated indoor setting, the virus can spread very quickly without even being very close to an infected person. Now, globally, Belgium is leading the way in this. So now it is mandatory for all those indoor venues to have a carbon dioxide measuring device. And if the carbon dioxide is higher than a certain level, then that venue has to close and they have to fix their ventilation. I think the most important place for that carbon dioxide monitoring is schools. We have to get better in making schools safer. When we have a lockdown and things improve, the first thing we should ease is to open schools back to on-site learning. But we owe it to the children and their teachers to make sure those schools are safe. And so I think a lot more attention has to be made to ventilation.
Right, particularly as schools around the world start reopening and restarting classes next month. But due to time, I'm afraid this is where we'll have to leave the interview today. That was Dr. Mike Tor, epidemiologist at Burnet Institute, and Dr. Chuan Oh, Professor of International Health Policy and Management at Seoul National University's College of Medicine. Thank you both so much for your insights today.
Okay, thank you. It's a pleasure.
And to our viewers, as always, thank you very much for watching.